Good evening, my name is Mumbi Mavuti and this is the Medi Health Show. Now today we are going to be talking about cancer. And guess who is joining me for this episode? Yes, I am joined by Dr. Robert MUTENGO, an oncologist here at KIRIAINI Mission Hospital. Thank you so much for having us.
Most welcome, Mumbi, to KIRIAINI Mission Hospital. This is our new oncology unit that was opened recently by His Grace, the Bishop of Muranga Diocese. Most welcome in.
Thank you so much. And today we want to talk and learn about cancer treatment and everything, including the causes and the prevention.
So in this department, we see patients every day of the week, Monday to Friday, with the clinics running majorly on Mondays when the oncologist is around. Here we screen patients for cancer, we make diagnoses, we stage them and we treat them with chemotherapy, hormonotherapy, targeted therapy, and immunotherapy, depending on the diagnosis. So you are most welcome to KIRIAINI Mission Hospital, newly opened oncology unit.
Thank you so much. And you're going to be talking more about cancer and everything else there is to cancer and what treatment will entail if you come to KIRIAINI Mission Hospital or if you visit any other facility out there. Yes, thank you so much, Dr. Robert, for making time for us here at Medicamp. Today we want to learn about cancer, but even before we get to the topic, our viewers would like to know you and better about you. I would kindly request that you introduce yourself to our viewers.
Good morning, good afternoon, good evening, viewers from wherever you are. My name is Dr. MUTENGO. I prefer to be called MUTENGO. Yeah, I'm a clinical oncologist. I treat cancers, majorly solid tumors, with chemotherapy, immunotherapy, targeted therapy, as well as radiotherapy.
Yes, thank you so much for that. Now, we really want to break down cancer for our dear viewers who are watching us back at home. And we're not going to talk about any specific type. We just want to talk about cancer as a whole. And let's just begin right there with the basics. What is cancer?
Cancer is any abnormal growth. Any abnormal growth can be categorized as cancer, though there are others that are non-cancerous. But there are key features that makes a tumor or makes an abnormal growth become a cancer. Those are features that we look at during pathological examination or during examination in the lab to establish whether the tumor is really a cancer or not a cancer. So looking at it from outside, you can't really tell whether a tumor is a cancer until it is examined. Yeah.
Thank you so much for that. And then maybe later on in this discussion, you're going to be talking about screening and how all that is done. But right now, how much as a country are we affected by cancer, any type of cancer for that matter? What is the prevalence rate in our country?
Cancer is of great importance in our modern world today. It poses a great burden in the family and even in the community at large. As of last year, 2023, according to the NCI, that is National Cancer Institute, which is an arm of the Ministry of Health, we recorded over 42,000 new cases. Over 42,000 new cases of cancer were diagnosed in 2023 alone. And out of those, it is estimated that 9 patients die of cervical cancer alone each day. We lose about 9 patients with cervical cancer. So you can see it's really a great burden. It affects not only the individual, but the family, the community, and even the nation at large.
Thank you so much for that. And you happen to mention cervical cancer. What other types of cancers are common in Kenya today?
Well, the top 3 common cancers in Kenya are breast, lung, and prostate. Yeah. Then there are also others like esophagus and cervix and the rest of them. But in the order of preference, breast, prostate, and cervix are leading. Yeah.
Thank you so much for that. And What are some of the causes and the risk factors of cancer? Because you've talked of quite high numbers.
Yeah.
So what are the causes? What are some of the risk factors, so that if it's something that we could avoid, then we can?
So there is no one identifiable cause for cancer. It is actually several risk factors play a role in causing cancer. There isn't any one identified cause. So different cancers have different risk factors depending on one's lifestyle and exposure. If you talk about breast, if you talk about cervix, prostate, all these different cancers all have identifiable risk factors that have been associated with the development of cancer, not really causative agents. Yeah.
And if you could break down for us some of these risk factors you mentioned, some could be come from exposure or something.
Yeah.
What are they?
So we have like modifiable and non-modifiable, or internal and external. So if you have a family history of malignancy, you have a higher chance of getting malignancy. If you have genetic mutation, those are internal factors. You have a higher risk of getting malignancy as well. External factors like exposure, like career, what you do, the things we eat, the things we smoke or drink, the chemicals we apply on our cells. All those are external risk factors. Yes.
When you say things that we drink, nikachai
that is mostly the things that we do. Oftenly smoking and alcohol. Smoking alone has over 100 carcinogens. Carcinogens are chemicals that can transform a normal cell, to become cancerous. So those are over 100 in smoking rather alone. And also, of course, smoking goes along with alcohol intake. So also, cancers like breast cancer especially have been associated with smoking and alcohol intake. So smokers have a higher risk of breast, of lung, several other cancers, hematological cancers, head and neck cancers. All those have to do with smoking quite often.
Thank you so much. And dear viewer, must you smoke? I think no. And obesity, would obesity be a risk factor for cancer?
Yes, it is. It is a risk factor, especially for gynecological cancers. Obesity is. Because what happens in an obese person, they have a high level of estrogen in their circulation. The fat cells in the body, in the pathogenesis of cancer, the more fat a woman is, the more they have receptors for the estrogen hormone, and the more they're predisposed to cancers. So that is why it is a very important thing to control your weight just for healthy living. And also when you're diagnosed with disease, you must maintain your weight to minimize weight gain and also the risk of having the cancer recurring. So weight gain, yes, is a risk factor for developing cancers, ovarian, uterine, even breast.
Thank you so much for educating us on that. Now, what are some of the signs and symptoms that we should look out for and that should cause alarm that I could be suffering from cancer? Of course, it's not something that you could sit and diagnose yourself. Like you said, some of these tumors are not cancerous, but what are some of the signs and symptoms that one should see within themselves and they rush to the hospital to get screened?
Signs and symptoms are variable depending on the site of disease. If you have breast cancer, then you'll come up with a breast lump or just a dense breast. Not necessarily a lump, but you could have a dense breast that could be cancerous. Others may not even have a lump. They may have a lymph node in their armpit that is positive for cancer. So it is site dependent. If you have esophageal cancer, you have problems with feeding, you'll be losing weight. If you have stomach or colon cancer, you'll be having blood in your stool, poor appetite, weight loss, becoming weak every day. So it's quite varies depending on the disease site. There isn't any specific.
And when we talk about cancer, something else that we really must discuss is the stages of cancer. There are different stages and people get diagnoses at very different stages. Maybe what are these stages and what exactly do they mean?
So you must understand that staging is different from grading. We grade cancers depending on the aggressiveness of the cells to become cancer. If you have a pathology report, you look at how those cells have been categorized, then you're able to tell whether this cancer is aggressive or it is not aggressive. That helps the doctor to understand what kind of disease they are dealing with, whether they anticipate disease progression to be sooner or maybe the person will have a longer life to live depending on the level of aggressiveness. And then staging is based on the extent of spread of the disease from the primary site of origin to any other areas of the body. The primary the primary way that a cancer spreads usually is through the lymphatic system. So usually we'll have a tumor spreading to the lymph nodes, nearby lymph nodes, before it spreads to other areas of the body. Likely the lungs, the liver, the brain, and the bone. Those are the areas of primary interest as far as metastasis is concerned. Yeah.
And that is what gives us stage 1, 2,
exactly.
3.
So stage 1 disease is localized. You could have localized. Actually, stage 1, 2, 3 is localized or advanced disease. Then stage 4 is metastatic. So stage 1 up to 3 is curative. The treatment is curative. We treat the patient to cure them. Then stage 4, it is palliation. Palliation because cure is impossible when the cancer affects the liver, the lungs, the bone, and the brain. So usually we palliate the patient depending on the symptoms they come up with. Yeah.
When you say that it is localized, you mean that if it is breast cancer, it's primarily just affecting the breast?
Exactly. So for localized disease, the tumor, it is just confined in the area that it started. It has not broken the barrier to other areas of the body. Once that is broken, then depends how far has it gone. Could be locally advanced, meaning it has spread regionally. If, for example, in the cervix, a lesion starts in the cervix, that is localized disease. Then it grows to involve the entire cervix. Then it involves the lower part of the uterus or the side walls of the pelvis. That is locally advanced. The metastatic is when it spreads out of the pelvis to other areas of the body. That is metastatic. But for local advance, it's just right there. Yeah.
Thank you so much for that information. And mostly when someone gets a diagnosis that they have cancer, any type of cancer, they'll be told that you're in stage 1, stage 2, stage 3, or stage 4. And that will also influence the treatment, whether it is curative or it's more like managing it. But we have people who come to the hospitals with late stages and they cannot get really cured. Why is that? Does it mean that at some point you could have cancer and you don't have any signs and symptoms?
That is very true. And that is a typical picture of this population in Kenya or in Africa. We usually have poor health-seeking behavior. For as long as there is no pain, someone can stay with a lump for months or even years. Whatever shall bring them to the hospital is usually pain. And they'll start with self-medication, visit the pharmacist, get some painkillers, take some antibiotics here and there, until it gets really out of hand is when they come over to the hospital. By the time they come over, it's already metastatic. So that is because of poor health-seeking behavior, which is very common. Yeah. So depending where the lump is, we could live with it for 8 years before symptoms come up. Within those 8 years, I'm sure you've had self-medication, you've had so many things, on your own before you're seeking a doctor's attention, which is not a good thing. Yes.
And so that is something that we can really avoid if we learn to visit the hospitals. If something is not right with our bodies, that is something should improve on. It is the responsibility of our viewer and everyone in general. Now I want to talk about screening when they come to the hospital, because like you're saying, people will self-medicate themselves. Will go to the hospital, to the chemist, ask for some painkillers, and you think you feel better, but probably not even treating what you're suffering from. So how does screening and diagnosis happen?
So screening is very important actually, because we're able to pick up the disease early enough before it becomes advanced or metastatic disease. So screening is a good thing. It's a good tool. We should embrace, all of us, to check ourselves regularly. You could just walk into a hospital, do a mammogram, do a PSA, do a pap smear, check your blood. Generally, checkup is advisable for a healthy person. So depending on the tumor site or the tumor site, there are different screening tests that can be done. Routinely, according to the Ministry of Health, we have some few programs that run on for screening for specific cancers, like for cervix, for breast, for prostate, for colon. So depending what disease it is, you could have some screening done accordingly. Yes. For prostate, we do a blood test checking for PSA. For cervix, we do a pap smear. For breast, you could do a self-breast examination or do a mammogram. You see, things like that. Yeah.
It is important that we embrace our health facilities. They are there to help us deal with such matters.
Yeah.
We're going to be taking a quick short break, and when we come back, we want to talk about treatment and how to prevent cancer, because it is preventable, right, doctor?
Yes, it is.
Yes, see you
It
right
is
after
preventable, it is treatable, it is curable.
this. Yes, see you right after this break.
We are putting certainty in their future so you can have a peaceful life. Exploring emerging opportunities so you can explore life. Covering your health so you can share your well-being with others. Taking care of your investments so you can enjoy the fruits of your wise decisions. With Britam, we are assured of over 55 years experience in life insurance, health insurance, general insurance, investments, and retirement solutions. Britam, with you every step of the way.
Sharia hado ũngĩthomera gũkunya gita, piano kana mĩgambo nĩyo vocals. Rehoboth School of Music maheanaga mathomo ma kĩrathi kĩa igũrũ mũno. Macerere Nyeri Town harĩa opposite Naivas Supermarket, kana waranĩrie nao kũhetũkĩra namba cio cia thimũ 0715 031 506. Rehoboth School of Music, cama wa rwĩmbo nĩ inanda.
Andika maũndũ ta skiza tuni ya thimũ yaku. Hihinya *837*3213# na igwatĩre rwĩmbo rũrũ ta rũgambi rwa thimũ yaku.
Thank you so much for not touching that button. My name is Mumbi Mavuti, and this is Medicamp. We've been talking about cancer, and in case you're joining us, we've talked about what it is, what causes it, what are some of the signs and symptoms, and right now we want to talk about treatment. We're in this space that doctor is going to tell us where we are and what happens here. But Dr. we talked about the stages and how a patient would get diagnosed at a different stage, and how does that really influence the treatment of cancer?
So cancer treatment is multimodal. Multimodal meaning we use different modalities to treat cancer. For early stage cancer and for locally advanced cancer, we treat to cure the patient. So we employ different modalities. We do surgery, we do chemotherapy, we do radiotherapy. Those are the modalities that we usually employ in treatment of cancer. So this is a new machine that we just acquired recently for KIRIAINI Mission Hospital. And this machine is what we use for mixing chemotherapy. Chemotherapy, you'll understand that chemotherapy is quite toxic, and so it has to be secured. Even the mixing of the drug has to be done in a sterile environment, secluded place where only authorized persons are able to access. So the pharmacy usually we work hand in hand with the pharmacist, who will come in here and mix the chemotherapeutics depending on what I will have prescribed for the patient. The pharmacist will come here, will have to be gloved all the way to the elbows. Then they put their hands in here and mix the chemotherapy. Usually those toxic fumes that come out from the drug, they're able to escape off through the exhaust pipe. And then once that is done, then the drug is safe to be used or to be administered immediately. Chemotherapy usually comes in powder form, most of them, which are not active until they are mixed or they are constituted in their required proportions, and then they can be administered to the patient. Yes.
And you talked about other options for treating cancer,
Yes.
like radiotherapy,
Yes.
surgery. How does what is radiotherapy, and when, at what stage is it required?
Yes. So radiotherapy comes in at different points in the treatment journey. You could have radiation before chemo or after chemo. You could have it before surgery or after surgery, depending on the diagnosis and the stage of the disease. So usually the radiation is done in Nairobi. Many centers are in Nairobi, and also different counties have radiation therapy machines. Depending on the tumor, if you consider like the cervix, which is one of the commonest diseases or cancers around, radiation comes early in the treatment journey. So you're given radiotherapy and chemotherapy concurrently, meaning together. They're given together throughout a whole month or so. And then after that, you're able now to be assessed again by your doctor to be told how responsive your disease has been. Yeah.
And mostly when someone is diagnosed with cancer, say you've been told that you have breast cancer, mostly we tend to assume that you will have to go through surgery and your breast maybe will have to be removed. But is that really the case, or at what point is surgery included in the treatment of cancer?
Yes and no, depending on the stage of the disease. One of the basic principles of treatment of cancer is to resect. Whenever there's a tumor, resect. It's easier to deal with what is left behind after surgery than to deal with the whole lump as it is. So surgery has a very key role in all the cancers actually, apart from hematological cancers. All the solid tumors, surgery has a very important role in their management. Now, depending on the stage of the disease, your doctor will advise whether to go for surgery first or to do chemo first, or to do radiation and then surgery. It is dependent. Yeah.
Do you have cases where you had cancer, you went through treatment, you've been cured, and now you are well without going through surgery?
Yes, depending on the disease. Yes. Most cancers like for head and neck, you realize there's not much tissue in the head and neck to go for surgery. For someone like for a sinonasal cancer, really there's no tissue to resect there. You can't come out with the whole face of a person. So what we do is just to irradiate the person. So you give radiotherapy, then at some point you may need chemotherapy, and that just is all. You will not need surgery. Yeah.
And for these treatment options that we are discussing here, chemo and radiotherapy, are there some side effects that are associated with the same?
Quite often. Radiation chemotherapy is a bumpy journey for most patients. Depending on tumor biology or patient's biology, different patients react differently to chemotherapeutics. There are patients who tolerate treatment quite well. They can go through treatment uneventful. The majority of them, though, suffer really severe side effects. Nausea, vomiting, hair loss, body weakness, fatigue all the time, sexual dysfunction, all those come along. And even some chemotherapies can affect the kidneys, can affect, the immunity, and all that can happen.
Now, given that we are talking about these side effects, like when we talk about fatigue and everything, does it stop them from carrying out their day-to-day activities? What is the life of a cancer patient? What is their lifestyle? And what would you advise them? What kind of a lifestyle would you advise them so that they could prolong their life and also increase their chances of getting cured?
Well, toxicity to chemotherapeutic is patient-based. Like I say, there are patients who do quite well on treatment. Others really do badly. On just the same treatment that we give to patient A, patient B does quite bad on it. So you really cannot tell from outside. You just start treatment and then follow them up and see what toxicity the patient suffers from. Then you're able to intervene and treat them in good time. Many of the toxicity that comes up, usually most of it is GI related, meaning something to do with feeding, with bowel kind of a thing. Poor feeding, nausea, vomiting, diarrhea, acidity, and gas. Those are the most common side effects that we're able to control quite well with supportive medications. Yes.
Do cancer patients eat the same diet that we do, or should they have a special diet?
Yeah, cancer, you eat everything. I've had patients asking me whether they should take sugar, eat chapati, eat bread. And I'm wondering, where did you get all this information from? This is not like diabetes where you're told stop milk, stop this, stop that. For cancer, it's different. Enjoy your sugar in tea, enjoy your bread, enjoy your chapati, eat everything you want to eat. Of course, everything in moderation. Too much of anything is not healthy. And of course, there are other cancers like for stomach, colon. Well, we don't really encourage people to take lots of meat or beef because of how it causes indigestion. It takes even very long time to digest, even for a normal person. So those you eat once in a while, it's okay. But for the rest of the things, eat everything that you want to eat, really. There is no restrictions. Yeah.
Thank you so much for that myth. Here we learn and unlearn. So now unlearn that one. Yeah, so that is it about treatment, Daktari. And these are options that are quite available in the facilities, and most cancer patients can get treated. But do you think that finances is a factor in treating cancer, such that we have people who cannot access these services because they cannot fund the same?
Yeah, cancer poses a very great burden to families, to individuals and families and community, and even the government as large. Like I mentioned to you earlier, last year alone we had 42,000 new cases of cancer. You can imagine these are individuals coming from families and communities. Well, some may have some insurance, which comes in handy to help in treatment and all that, but many of the Kenyans do not really have insurance and do not have enough savings to cater for that treatment. So it's quite a challenge. It's really a burden that affects people. You realize that once someone has cancer, the entire family really or community comes in, where you have fundraising comes up, paid, like I've had experiences with patients who come requesting me to write for them a medical report, medical appeal rather, to go to Safaricom to have them generate a pay bill to raise money. So it's a big problem. I encounter this quite often. Or sometimes may want to give the best drug for that particular diagnosis, yet they can't afford it. So you go to option B, which is less effective as compared to option A. So those are challenges we encounter on a daily basis. Yeah.
That's quite sad. And I know you talked about chemo, you told us about the mixing of the drugs that is done right here in this chamber. And after that, we'd like to know what happens. How is it administered? Is it through a syringe? Do you take it through the mouth? Or what happens? And so you're going to be moving to the center where these drugs are administered, and right there, Doctor is going to be talking to us about the same. Yes, here we are, and this is the center where the patients sit and chemo is administered unto them, and at least I can see a drip stand. And so Doctor is going to be talking to us about that, and that there are different ways that chemo is administered to the patient.
Thank you, Mumbi. So it is important to note that chemo is usually scheduled. So you could have 2-weekly regimen or 3-weekly regimen, meaning that you're given your treatment after every 2 weeks or after every 3 weeks, depending on the protocol or prescription that your doctor has made for you and depending on the diagnosis. So right behind us is the chemo mixing chamber, which I showed you earlier with the machine behind the wall. So once the chemo has been mixed, it is delivered through this window here that you can see. So the nurse on this side will receive the chemotherapy, and the patient usually will be sitting on the couches that you can see. So depending on the chemo that is given, intravenous access is attained usually before that, and then the chemo is hung on this drip stand that you can see beside every couch. So that should run for about 2 hours to 6 hours depending on the chemo that one is getting. It runs quite slowly through a vein into the body. That should take all those many hours just to prevent toxicity. So that is how chemo is done. And the different modalities that we use, most of the time we use intravenous access because it's affordable and anyone can do it. Our nurses are trained to do intravenous administration, as opposed to chemo pots, which are put on a central vein that needs specialized services. Yes.
And do we have any other way that chemo can be administered, or is it just through there?
Yeah, so chemo can be given intravenously. I would say 80% of the chemos are given through a vein in the body, or it could be a tablet form. It could be subcutaneous, like just under the skin, or it could be IM or intramuscularly that is injected into a muscle. Yes.
Thank you so much for that. And now we've come a long way talking about cancer and treatment and everything and the finances involved in treating cancer. Now, is it a possibility that this is going to take a toll on one's mental health and even perhaps on the people that are taking care of them? And are our facilities also catering for this?
Thank you. So, like I mentioned earlier, cancer is really a burden to not only the individual, but the family and the community at large. So, you realize it affects the person financially, socially, emotionally, spiritually, and otherwise. Their life literally changes and everything comes to a standstill. So, all the resources are now channeled towards treating this patient and ensuring they recover their health back, or at least to a certain extent, they're able to live a normal life. So yes, cancer is really a great burden, and we are looking into aspects of where we treat the patient holistically, meaning we look at it like spiritual needs are catered for, nutritional needs are catered for, physical needs are catered for, emotional and all that is encompassed through the continuum of cancer care. Yes.
So counseling is offered
Definitely. Counseling is offered to maintain their mental status. Many of them go into depression, like denial, those kind of things they go through. So mental health aspect has to be taken care of throughout treatment of these patients.
And that is quite important. Now, Dr. maybe, can cancer be prevented?
Yes, cancer is preventable and cancer is curable. In medical school, they used to tell us everyone has a gun, but your lifestyle is the bullet that you'll use to shoot yourself. So every one of us has a gun. Literally, everyone has a gun. Your lifestyle is the bullet you'll use to kill yourself. In your lifestyle, meaning there are things that we do to our bodies that put us at risk for developing cancer. Many of the recent lifestyle ways that people live have been associated with the development of cancer. Smoking, which is very rampant in young men and women these days, alcohol intake, many of the food additives we take, barbecues all over town, all these are risk factors for developing certain cancers.
Thank you so much about all that information. And it is true that if we watch our lifestyle, then we have a chance at preventing cancer and of course a lot of other diseases. I want to summarize that into that there isn't a magic bullet for health. You have to live healthy in order for you to be healthy. That's the fact that you're going to cover today here on Medicamp, unless there is something that you want to put emphasis on as you part our viewers.
My parting shot is that cancer is curable. Forget about this media and all that once someone has cancer, they are condemned to death. Cancer is actually curable, depending on the stage that is, the stage of diagnosis and the treatment that is available. You can actually be cancer-free. I've had quite a number of success stories where patients have been cured from cancer. So yes, it is curable. It is a battle that you can win. Once you are diagnosed with cancer, it is not the end of life. You can actually have your life back again. Thank you so much.
Thank you so much for making time for us, and that was quite enlightening. And yes, cancer is not a death sentence. Cancer can be cured, and one day, Dr. you're going to give us one of those success stories so that they can share with our viewers and so they know that cancer does not have to kill you. You can go through treatment, you can be cured, and you can live a normal life. My name is Mumbi Mavuti, and this has been Medicamp, your daily health show that comes here at GTN TV, the home of gifts and talents. Until next Tuesday, keep that button there. We're going to see you in another episode.
We are putting certainty in their future so you can have a peaceful life.